Yay! Okay, we are live. Welcome, everybody, to our second week of our self-care experience. We are talking about self-care while social distancing, self-care during the holidays, and self-care all the time for your life. I am so excited to be here in your home, wherever you are. Hopefully you're cozy on the couch or enjoying a nice evening. Maybe you have a glass of wine or a delicious healthy smoothie, as Lisa will tell us to have. And you are here with us this evening to talk about health, wellness, taking care of ourselves, and how we can actually plan for that. So first of all, I want to introduce myself, and then I want to introduce our wonderful guest. If you do not know who I am so honored to meet you. My name is Kelly Youngs. I am the founder of She Is Fierce. We are an organization with members all over the world, but tonight we are super excited to be connecting, especially with women in North Florida who are in the middle of life and COVID and homeschool and all the things, and still wondering, how can I actually care for myself so that I can then go out into the world and be better at my job, be better mom, be better caregiver, and all of the things and all the responsibilities that each and every one of us take on every single day. So I am so delighted to introduce you to our special guest this evening, Lisa Bradford. She is a registered nurse with Baptist Health. She is the in-house health coach. So you can actually connect with her in real life. So not only do you get to connect with her here, you can connect with her and the Baptist Health for her team. And Lisa, can I ask you, you have an amazing story and a background that blew me away the first time I met you. Can I ask you to share a little bit about yourself and what you do with Baptist?
Yes, hi, Kelly, and everybody. I've been a nurse for 28 years, and I also am a certified personal trainer, health coach. At Baptist I have practiced most of my life as a nurse. I worked in cardiac, neuro, and in the operating room. And after that, I took a little adventure to overseas and worked at a company, oil company. And that is when I transitioned into health and wellness. That was my passion for years. I remember being a new nurse at Baptist and walking into work every day, and I would daydream about the perfect job. And I'm serious, I used to do. Okay, the perfect job was I wanted to be a nurse, but I wanted to work in health and wellness. And I didn't know who would ever pay me to do that. And so what happened was also, working at the bedside with patients, they motivated me to be a role model and to be where I'm at today. You learn a lot from people that are sick in the hospital. And so they just ignited me as far as my passion. And then with the opportunity overseas, I'm working my dream job, and that's with Baptist Health with the For Her program.
So delighted to have you here with us tonight to talk about this broader concept of self-care. We started talking about it last week with Dr. Calhoun, who gave us a great overview of living with COVID, the things that we need to know in this crazy moment in everybody's lives. But tonight we really wanted to go deeper on just health and wellness generally, and how to not just say, I want to get healthier, I want to eat more vegetables, I want to go for a run every day, but instead to create a real plan. And anyone who is a part of our She Is Fierce community knows that I am constantly using the word strategy. I love a plan. I love, goals and objectives and putting all of these things down on paper, because you are so much more likely to actually do what you plan. And I want to make sure that we mention that you can actually download, if you have not already done so, you can download our gorgeous fillable, printable workbook. You can go to sheisfiercehq.com/self-care. And I know we will share that in the comments as well. And you can just click on that link and you will get in your inbox a gorgeous downloadable document that will take us through the next 10 weeks of videos and interviews, and is also something that you can keep as a resource. And my favorite part, to be honest, is the part where we plan, because there's a lot of great insight about health and wellness, and great recipes and great tips and tricks, but none of those mean anything unless you know where you're going. So can you walk us through how you kind of have learned from your clients and your patients and all of the people that you've been dealing with every single day and dealt with years ago in the room, and through your 3 decades, I think, of working in hospitals and in healthcare? What are the things that you've learned from those people about what actually works when people set their mind to taking care of themselves, right? And not necessarily meaning you have a serious illness and you have to stop down and take care of yourself, but really, I think many of our community who will be watching are women just like me, who have 2 children in another room and have a job and have all the things going on, and need to be strategic about how to take care of themselves. Can you walk us through that?
Yes. First of all, I find that we're overwhelmed. There is so much to do. And how do you do it all? And who's perfect? I know I'm not perfect.
I am not.
No, it's hard. And so what I have found with people that, especially health coaching and my personal training clients, they'll go, Lisa, I don't have time. And I go, well, let's sit down and let's actually look at your schedule. And they do. We all have busy schedules. And I go, you need to make an appointment with yourself, because you will be forgotten. You'll be just taking care of kids. You'll be taking care of your parents, to-dos, must-dos, right? So you have to start with yourself. And if you're not well, how are you going to manage all these people in your life along with your schedule? So that is my biggest, is life is going to always be busy. So you have to make
do we? I always think tomorrow I will have everything sorted out, and then I will be able to begin on my path of wellness. And that's just not reality. We have to be strategic. We have to, download beautiful workbooks like this and fill out our goals, and not just our goals, but our path to get there.
Exactly. I'm a big believer in writing things down, intentions, goals. And I have fun with it because I will reflect back, and I'm perfect for this topic because I enjoy about every December, I start looking ahead of what I want to accomplish the next year. So it's just something I do. And I'm a big paper and pencil person. I know that. I'm old fashioned. I know a lot of people love their phones. Use technology. If that's your friend and that's your go-to, having reminders or having fun with the calendar, a planner. And then, like I said, I'm old fashioned. I actually have friends that laugh at me because they can't believe it. And I'm proud of it. It works for me. So you do what works for you.
Yeah, I love that. And, I have to say, so I'll share just a tiny bit of my own experience, because I think that many women will probably relate to this. So I obviously started She Is Fierce about 5.5 years ago now. And at the time I had a baby and a 2-year-old, and I was starting a business, and I was really honestly not thinking about it really even as a business. I just thought, this is something that matters to me. I felt very passionately about what I wanted to create. And so, of course, and I was also like going to the gym religiously, thinking, have to lose the baby weight, have to do this, have to do that. And in that moment of trying to do all the things and be present for all the children and the work and the vision and all of those things, I realized that I had to pause, right? Which is the hardest thing, especially for me. I don't know if everyone else has this, but pause and think about, what are the things that are most important right now? And what can I either wait, or what can I moderate for the future? And, in some ways, I think that was so good for my mental health, right? And I think that And I highly recommend that everybody do that if you're in that situation of just overwhelm. But also, to be honest, for me, it also made me think, okay, calm down. You don't have to go to the gym every single day, right? So then I had the outcomes of that. And so even though one area of your life is more healthy, there could be another area that you're struggling in. So what are your recommendations for people who are like, I've got this together and this together and this, and I've got my plan and I've got my planner and I have it all sorted out, and yet I still struggle?
Okay. That is when you have to hold yourself accountable.
Mm-hmm.
If you're writing intentions and you're not following through, I mean, to me, I mean, it's either meet with a health coach then, and maybe we can help you with that journey, or maybe you need to look at your schedule.
Mm-hmm.
What I did years ago is I was a wannabe exerciser. I believe it or not, and I have been in fitness, personal trainer. I mean, I've done competitions, and I was wondering why I wasn't following through.
Mm-hmm.
Because I wanted to, but I'd get busy with my day, and then all of a sudden at 5 o'clock, I was tired, and then I had to put dinner on and everything else. So I decided to go backwards. And I go, okay, you're going to exercise. You're going to do it first thing in the morning.
Mm-hmm.
Now it's tough because if you're not a morning person, but I knew that at that point, if I did that first, then I would follow through with it.
Yeah.
And along with it, then it became a habit. And believe it or not, I felt energized because it changed the way I felt about my whole day.
Yeah. I absolutely believe that.
I'm telling you, so it works. But I mean, as far as what you're talking about, I mean, that's one strategy. I like to look when I meet with a client, I will look at their day and I don't tell them what they need to change or do. It's funny, as you start talking to somebody, you figure it out yourself.
Mm-hmm.
It's you know what you should do or what the answers are.
Yeah. I love your advice about finding a coach, right? Which I think many people hear that. I know certainly I work with lots of coaches in all different areas, whether they're business coaches, career coaches, or health coaches.
Right.
And one of the common things that people immediately say when you say find a coach for that is it's too expensive, or I don't really need that. I need to do this instead. And the truth is we can only take responsibility for so many things and for solving so many problems. And I think in our busy world that we're living in, finding somebody who's really an expert, as you are in this area, who can help you walk through, just as you said, who can kind of walk you down the path of here's what's going well, and here's what maybe can be worked on, and here's what you really need to sort out, and help you create that plan can be really powerful. So I know that's something that you do every single day and that you do with For Her. So can you talk a little bit about that program? Every event we have with Baptist, I'm always telling people to sign up for this because I'm blown away by the fact that you provide this to the community. So can you share it?
Yes. The For Her program is made for women, us busy women. It can be housewives, it can be moms, it can be business ladies. It's anybody in the community, the Jacksonville community, and it's empowerment. It's having events with you. She is fierce. It's improving your health, wellness. We do have physicians that when we were doing events throughout the community, we would have events like a self-defense class or yoga.
I went to one and learned a lot.
And I know, and then we would have a physician speak on a topic. We do have healthcare navigation along with the For Her program, and myself with the health coaching. So it's a fantastic program for women. And another thing that's really neat about this program is we bring women from all over Jacksonville together. So it was interesting. We had an event. It was a good year and a half ago, but it was a Baptist Health team, and they decided to use it as a girls' night out. So they're all colleagues. It was about 6 of them, and they live all throughout Jacksonville, and they always wanted to get together, and that was their opportunity. So they would treat that as their girls' night out.
Yeah.
Yeah.
So, I want to say hi to Karen. I want to encourage, if you guys are watching this, I know we have people watching this in many different places, so we may not be able to see everybody that is commenting or with us right now. But if you are, comment and let us know. And if you have questions, especially for Lisa, tag Baptist for her so that we can make sure to follow up and answer those. And of course, you are always welcome to tag me if you have any questions for me as well. So, Lisa, I have so many practical questions for you. I love this topic. I tell everybody, I walk people through strategy for their businesses and for their lives. And yet I still love to hear in particular about health and wellness, about how you recommend people build health and wellness into their day, right? And I love in particular the idea of focusing on your mental health and your physical health and how you incorporate those. So can you give me all of your wisdom in just a few short minutes about how to plan, I'll take this selfishly. If I'm looking at my calendar, what is your recommendation on how to make the most of the hours you have in the day and the hour or the minutes that you have in between your other life obligations?
Right. Everybody's individual, and we all have different struggles. We have different goals. We also have different roadblocks. And roadblocks. What I would say is that you need to prioritize where you're at. I know that COVID-19 pandemic has definitely has adjusted people as far as I'm very much a planner. And I have to admit, back March, April, May, I was kind of struggling because I just felt off. And then it was like I dug deep and I go, you need to get back to your routine and just keep on the path. Being healthy, well, incorporating all the good things in your life, it's a journey. You can't just magically just turn it on and just have everything perfect. I would say working on one thing at a time. I would prioritize and look at what is the most important item that you would like to succeed in. Set goals, smart goals on that, and be nice to yourself. Don't say every day I'm going to go exercise, because you're going to fail.
Yeah.
And if you're not an exerciser, you definitely can't do that.
Yeah. So, I just want to reiterate, I love that advice, because I think, as we kind of said at the outset, I think so many times, I do this myself, but even more, I meet with people who say, I'm going to change everything right now. And when you have everything else going on, which, and I speak especially to the women who I think are watching this, who are just have tons going on and have so much in our lives. And so in order to really feel like you're being successful, you have to build realistic goals over time.
Exactly. It's, and this is a difficult time right now. I think you have to be nice to yourself and give yourself a break. And you can also change gears, and also maybe this is the time where you just need to regroup and put your and just center yourself and try to be calm and write out, if it's COVID, maybe it's employment, whatever your situation is. Writing down your intentions, what's important, I think will help you with clarity. So when you do come upon some craziness in your life, you can go back to those and So that's
know where you're actually going, right? So
right.
I want to ask you a question that Jeanette is asking, because I love this question. And I would imagine that most people who are watching this are experiencing this or have done in the last 6 months. So Jeanette is asking, how do you recommend that we keep our sanity while working at home 24/7, keeping your standards, whatever they are, as a homemaker, as a wife, as a caregiver? I think especially right now, I shared this last week. I was with my children, I'm not exaggerating, almost 24/7 for about 6 months. And that was an incredible blessing, right? And there were so many moments that I was really grateful for. But of course, while you're also trying to work and also trying to do all the things, it can be challenging to just fit things in. So that's a tough question. What is your recommendation? I'm sure you've dealt with this question before lately.
I think that's when you have to dig deep and you have to really, it's always going to be crazy.
Mm-hmm.
You know, I mean, yes, this is definitely a difficult time, but I think that's when you have to really dig deep and, you know, maybe just alone time.
Yeah.
And that is when, and try to figure out what's really important. And I think that if you can keep on going back to your intentions that you write down, that will help steer you through that. Does that help at all? And I mean,
Yeah.
you're gonna be a homemaker. I mean, it's not gonna go away.
Yeah.
And so I
Yeah.
think you really have to dig deep and you have to find out what is important to you. And then maybe you find that you know, taking a walk for 30 minutes or even 20 minutes by yourself, putting on your favorite music, or you know, maybe, you know, yoga with some meditation, something just for you.
Yeah, something that brings you peace, right? So,
Right.
and I just want to add to what you're saying. I think the other, I know from my own experience, don't turn to a device, right? So everything that you listed is something that is either physical movement or calm and peaceful, or it's music. So even if it has an entertainment aspect to it, it isn't simply becoming a passive person who's tuning out, right? And that allows you to kind of center yourself.
Right. And I mean, I'm working from home also, and I find that because here you are, you're at your home, you're cooking, you're working. I go for a quick walk just to get some fresh air and get some fresh thoughts going. I sit back down to my computer, and all of a sudden, I'm just like putting on an email, and it seems so that for me, even just getting outside just for a minute, seeing some sunshine.
Yeah, I love that. And especially if we're lucky enough to live in Florida as we do right now.
Right, right.
So I have another question for you. This is a little bit more complicated medical question, but I love it. So I'm going to pose it to you. And I honestly think I might know the answer because I have been to some heart health wellness events with you and with Baptist. So Marianne is asking, do you and Baptist generally, I assume, reach out to the medical community and in particular physicians on the differences between men and women who present with the symptoms of heart disease? So I know, you know, in particular in North Florida, that is an area that you guys are very involved in.
Right, it is. And I know that we've had actually for her, we've had a physician speak on heart disease with women. But we our hospital has a great set of physicians, specialties. Do you want to know the differences or like
So,
what?
Marianne's adding more questions I want to add. So she said, how can women communicate with their, excuse me, with their healthcare providers so they're taken seriously? That is a great question.
It is. It
Hold
is.
on.
It's I believe what I've heard is I think that physicians are taking women more seriously now because we don't have the traditional signs as men. I I would state your symptoms. I would go in if you're going to see your primary care doctor. I would believe that they would take you seriously. I that's where I'm at with it.
Yeah.
I think 20 years ago that might have been the case, but
Yeah.
that's my
Well,
experience.
just to add to what you're saying, I think also, unfortunately, I've had lots of friends and family in the last couple of years that have been dealing with all different kinds of health issues. So I've been very close to this. And I know just being an advocate for yourself, right? So just as we're talking about from a day-to-day basis, thinking about self-care, thinking about how, whether you're talking about illness or just life and feeling good. And as you said, getting out and getting your mind cleared or getting a little bit of physical movement. Also, when you're talking about really serious illnesses and you're actually going into a physician,
Right.
being an advocate for yourself and being confident in how you feel can be really powerful. And I know I have sat with, women in my family and had to reiterate, this is to people, to physicians and other people who really wanted to do their best, but they can't feel what you feel. So I think that
Right.
and even, just to bring it back to the self-care, I think that's also true in your home. The other people in your home or the other people in your work environment or your broader community, they're not experiencing what you're experiencing. So you have to advocate for yourself and speak up about, whatever your struggles are.
Yeah, I think being a good record keeper, writing it down, walking in to a physician's office, and if it's blood pressure, having a record,
Yeah.
taking blood pressure, 3 times a day, and with times. But I mean, that's what I would say, and trusting yourself. I think we all know ourselves well enough when we're not feeling well, and I do understand it's subjective. I mean, somebody has to believe you, but I think that if you walk in there confidently, and especially if you have a record like data, so
Yeah, I love that. And so I want to take it back to our conversation, which is another piece of this, which is all about writing. And this is just our theme for tonight, writing things down. So whether it is a serious illness and you are tracking your symptoms and making sure that you're being very clear, but also just day to day. One of the things that you were talking about earlier is you were talking about how we set intention and how we make space in our day. That came up in my mind was gratitude, right? And so that's something that I love to write down, gratitude, because it helps me in the moments when I am thinking, what is happening, right? So in that 6 months where I thought, I don't know if I can do this tomorrow, I was able to kind of focus on the areas that I was grateful for and see the blessing. But I think if you don't, I know for me, if I don't take time to actually think about that, you get caught up in the stress of the moment. So can we go back to and kind of wrap our conversation up in this idea of intentions? And I want to make sure to say, because I said it before, but in case anyone has joined us again now, that you can grab the beautiful download for this at sheisfiercehq.com/self-care. And we were going to add that link in here. And on page 8, we have a fillable and, a beautiful workbook that you can actually print and write in, where you can set your intentions. And I think we have space for about 5. Of course, you can grab a journal and fill out as many intentions as you want. But Lisa, can you walk us through what that might look like for any woman who is kind of, for the very first time thinking about, I need to focus on myself. I need to make sure I'm making space for myself. What does it mean to actually write an intention?
intentions for me, it's very personal. And I think that being alone and actually not, you can't do this in a rush. You can't be writing it down in a car or at a doctor's appointment in the waiting room. It's something that I think you should reflect and actually think about what is important in your life.
Mm-hmm.
And, maybe you write down 10 items. What are the most important things in your life? And at that point, then start expand on that. it's and then following through. So if you write down, let's say one thing, let's say you decide, all right, during COVID-19, I am going to take 1 hour in my day to work on myself professionally, personally. And by the end of this pandemic, I will be ready for whatever you decide, whatever you decided that is important to you. Right there is an intention. Then you have to decide how you're going to get to that point.
Mm.
And and that's when you have to really narrow it down.
So I want to give some examples that I know you and I have talked about.
Right.
And one of them, which I love, as I just shared about, my own experience with my children being home, is I will keep my patience with my children and remember that they need me to be calm right now. Right. And I think that if you had said this a year ago, I would have been like, yeah, of course, that's easy for me to keep my patience with my children. I don't have to struggle with that, right? And yet when you are day to day faced with childcare, in addition to all of the other things, that can become something that is either an ongoing or a new challenge. So right. I love the intentionality of writing your intentions and being really clear. And I love that you kind of lead with that as one that I think many of us need to kind of build into our strategy for the day and our plan for how we're going to approach the month ahead or whatever it might be.
Right. It's if you follow through, first of all, if you start out with an intention and then you start doing the steps,
mm-hmm.
You commit yourself, you will find yourself, into a habit.
Yeah.
And it will sneak up on you, but it's a good thing. And the COVID pandemic, I have decided I am going to treat it. It is negative, but for me, it's like this newfound time
mm-hmm.
to work on myself and to improve. And so you've got to. It's not easy, and with a busy life, but you have to make an appointment with yourself.
Yeah.
Make it happen.
I love that. And as we talk about, we've been talking a lot about mental health and just general wellness, but also from a just physical health and eating well and getting exercise. How do you recommend that people frame their intentions? So as we talked about earlier, the difference between maybe saying, I'm going to eat healthy food now, and making a real actionable, smart goal that you can truly enact.
First of all, you start out small. If you decide you're gonna try to work on your food choices, I would not. I don't know. I started off years ago, believe it or not. I'm going to share this with you. I decided I was going to stop adding salt to my food. And it was so funny, and this is the truth, because I used to add salt to my food without even tasting it. And I decided I wasn't going to do that anymore.
Mm-hmm.
And honestly, it just kept going. You work on one thing, and you just, so then, I can't remember what else, but for me, it's a journey.
Mm-hmm.
I treat health wellness as a journey. You cannot instantly, magically be perfect. And I'm always striving to be a better person.
I find it very annoying that we can't just be perfect because we decided we want to.
Not going to happen.
That is my truth. I find that very frustrating. But I do think that you are at least giving us a path to start to enact the things that we need to do to get closer, if we're not there.
Start small.
Exactly. So after we've written down our intentions, what comes next?
So, all right. So you wrote them down. Well, you have to action.
Yeah.
So it's putting in action, and there's all kinds of excuses. There's all kinds of reasons not to follow through. Using myself about exercise. I was wondering why I was never following through.
Mm-hmm.
And I finally sat down and I go, well, okay, it's because you're exhausted by 5, 6 o'clock. And of course, you're not going to go exercise. So I decided to front load it. And to tell you the truth, that is how, for me, but I had to look at my schedule.
Yeah.
And that is the only time. And so I started that journey, I think it was like 27 years ago.
Oh, wow. Well, I feel like you're speaking to me personally. I love that because I love working. I genuinely enjoy working out and going for a run, but I love doing it in the afternoon. That is my time. And since
Right.
I've had children, I have struggled because you don't really have a choice. You have to watch them during that time. And so I love I mean, it seems so simple, but sometimes the simplest things are the things that can really help us move forward. So I love that, creating new habits, being strategic about your schedule, and getting your intentions and your plan on paper.
Yes.
Now, of course, as I always do, as we wrap up, I want to ask you, do you have any final words of wisdom that you want to share with the women who are watching us now? And I know we will get thousands of women who will watch this later. So are there any, no pressure, are there any
No.
words of wisdom you want to share with them?
I love it. First of all, be nice to yourself. We are not perfect. And Kelly, not perfect.
Well, I certainly don't think I'm perfect, but I want to decide
I
I'm
know.
perfect and have it happen.
You got to let that go. I say be nice to yourself, but you have to, if you want to make changes, you've got to figure out where you're going wrong. I think that if you look at where you're going wrong, then you need to be a big girl and figure out how I can correct this.
Mm-hmm.
I would say starting off 2 to 3 times a week for sure, and it's treating it like a doctor's appointment. It's like you wouldn't miss a doctor's appointment, and you've penciled in that time for your whatever you're going to do.
Mm-hmm.
Follow through. I would say what else? It's just be, and I health wellness. It's a journey. I have fun with it, and once you are consistent, and you feel like you've actually done this, accomplished this, it leads on to another one. You know that. Anytime that you are successful in anything, it empowers you and gives you the confidence to move on.
Yeah. Well, that is beautiful. And I love so much about what we talked about, writing things down, being intentional. You touched on the power of building new habits. And I also want to say, I love Marianne is adding in educating and empowering women, right? So not just, of course, that's what She Is Fierce is all about, not just working on ourselves, but once we find some peace for ourselves or find that sense of health and wellness, that we then move on and look outward and lift others up. So I love that. And thank you for sharing that as well, Marianne. So again, I want to remind you guys that you can tag Lisa, you can tag Baptist for her, and you can tag me and She Is Fierce if you have questions after. If you're watching this tomorrow or in the next couple days, you are welcome to tag us. And Lisa, of course, thank you so much for joining me on a Thursday evening. Thank you to every single one of you who joined us live. We are especially grateful for you and everyone who watches this later. And of course, make sure you download the She Is Fierce hq.com/self-care. It is a self-care experience. It's a community experience. We are doing it together on social every single Thursday evening. You will see me here again with some incredible special guests from Baptist. And every single Monday, you will get an email in your inbox that will give you some motivation and some inspiration to start your week off right. So make sure you go and download that. And in the meantime, we hope you have a wonderful evening and a wonderful weekend ahead, and go and actually put some of these things into practice. I know I'm going to pull out my planner in the morning and get to work. So thank you, Lisa. We appreciate it.
All right.
Bye, everybody.